Increase fruits and vegetables, especially green leafy vegetables, cruciferous vegetables, broccoli, cauliflower, cabbage, and fruits like apples, tomatoes, berries, citrus fruits, and cantaloupe. These are rich in fiber, antioxidants, and compounds that can help balance hormones and reduce inflammation. Include whole grains and legumes. Oats, lentils, barley, and beans provide fiber, which aids in removing excess estrogen from the body. Prioritize healthy fats, flax seeds, rich in omega-3s. Avocados, and fatty fish like salmon and mackerel can help manage inflammation. Boost vitamin D. Vitamin D may help reduce the risk of fibroids. Sources include egg yolks, fortified milk/dairy, fortified cereals, fortified orange juice, and fatty fish. Sunlight exposure is also key. Consider green tea. Contains antioxidants that may help reduce oxidative stress. Limit or avoid red meat and processed meats may increase the risk of fibroids. Refined sugar and refined carbohydrates can contribute to inflammation and potentially fibroid growth. High-fat dairy, conventional. Some sources suggest limiting. Organic dairy may be preferred. Alcohol and caffeine may raise hormone levels and trigger inflammation. Trans fat.
How to reduce myoma?
Uterine myomas, also known as fibroids, are non-cancerous growths that develop in the uterus. The approach to reducing myomas depends on various factors, including the size and location of the fibroids, the severity of symptoms, whether you desire future pregnancy, and your overall health. Here's a breakdown of common approaches to manage and potentially reduce myomas. 1. Lifestyle and dietary adjustments may help with symptoms and potentially slow growth, but generally don't shrink large fibroids significantly. Diet. Increase fruits, vegetables, legumes, and fish. A Mediterranean-style diet rich in these foods may help lower the risk of fibroids. Limit red meat. Eating beef, ham, and lamb may increase fibroid risk. Reduce processed foods and added sugars. These can raise blood sugar levels and insulin, potentially contributing to fibroid growth. Increase fiber. Fiber-rich foods like whole grains, oats, lentils, and beans may help prevent and slow fibroid growth. Include dairy. Dairy products with calcium, phosphorus, and magnesium may help prevent fibroids and slow their growth. Green tea contains antioxidants that may help slow fibroid growth by reducing inflammation and high estrogen levels. Weight management. Obesity and excess weight can increase estrogen levels, which may promote fibroid growth. Losing weight can help. Vitamin D. Deficiency in vitamin D may increase the risk of fibroids or worsen them. Foods like egg yolks, fortified milk, cheese, and fatty fish, salmon, tuna, mackerel are good sources. Supplements may also be considered after consulting a doctor. Exercise. Regular physical activity can help manage symptoms and may reduce the risk of developing new fibroids. Stress management. Techniques like warm compresses, warm baths, yoga, and massage therapy may help manage stress, which can indirectly impact fibroid symptoms. Limit alcohol and caffeine. These may be linked to fibroid development. Quit smoking. Smoking can negatively impact overall health and may influence fibroid risk. 2. Medical treatments. Aim to manage symptoms and, in some cases, shrink fibroids. Pain medications, over-the-counter or prescription pain relievers like NSAIDs, can help with mild pain. Hormonal medications. Birth control pills, hormonal contraceptives, can help control heavy bleeding and painful periods. However, they may sometimes cause fibroids to grow larger. Progestin-releasing IUD, intrauterine device, can reduce heavy and painful bleeding but doesn't directly treat the fibroids themselves. Gonadotropin-releasing hormone, GnRH agonists/antagonists, e.g., Lupron, Cinarel, Zoladex, Myfembree, Orion. These medications reduce estrogen and progesterone levels, leading to a temporary menopause-like state. This can significantly shrink fibroids, up to 50% reduction in uterine size, and stop menstrual flow, improving anemia. However, long-term use is typically limited, e.g., 3 to 6 months, due to side effects like hot flashes, bone loss, and potential fibroid regrowth after stopping treatment. They are often used short-term before surgery to shrink fibroids. Anti-hormonal agents, hormone modulators, e.g., ulipristal acetate, mifepristone, letrozole, can slow or stop fibroid growth, reduce bleeding, and improve symptoms. Tranexamic acid, Lysteta, a non-hormonal medication that reduces heavy bleeding, taken only during your period. It does not shrink fibroids. 3. Minimally invasive procedures shrink or destroy fibroids. Uterine fibroid embolization, UFE/uterine artery embolization, UAE. This procedure involves injecting tiny particles into the arteries that supply blood to the fibroids, blocking their blood flow. This causes the fibroids to shrink and die. It's a minimally invasive procedure with a quicker recovery than surgery, but it may not be suitable for women who plan to get pregnant. MRI guided focused ultrasound surgery, FUS, a non-invasive procedure that uses high-intensity ultrasound waves guided by MRI to heat and destroy fibroid tissue. It requires no incision and is often done on an outpatient basis. Radiofrequency ablation. A probe is inserted through
Oh, buko. That's all. Does 15 cm myoma need to operation?
A 15 centimeters uterine myoma, fibroid, is considered quite large, and while not all fibroids require surgery, a fibroid of this size often does, especially if it's causing significant symptoms or complications. Here's a breakdown of factors that determine the need for surgery. Factors that make surgery more likely for a 15 centimeters myoma. Symptoms. Large fibroids are more likely to cause severe symptoms. These can include heavy and prolonged menstrual bleeding. This can lead to anemia, fatigue, and impact quality of life. Pelvic pain and pressure. A 15 centimeters fibroid can press on surrounding organs like the bladder or rectum, leading to frequent urination, difficulty emptying the bladder, constipation, or a feeling of fullness/bloating in the abdomen. Pain during intercourse. Abdominal enlargement. A fibroid this size can make a person look pregnant. Impact on fertility or pregnancy. If you are trying to conceive or are pregnant, a 15 centimeters fibroid can increase the risk of infertility, cause complications during pregnancy, such as miscarriage, preterm labor, or issues during delivery, e.g. requiring a C-section. Rapid growth. If the fibroid is growing rapidly, your doctor may recommend removal to rule out rare cancerous changes, though fibroids are almost always benign. Compression of other organs. A large fibroid can press on the ureters, tubes from kidneys to bladder, potentially causing kidney swelling, hydronephrosis, and kidney damage. Failure of conservative treatments. If medical therapies or less invasive procedures haven't effectively managed symptoms, surgery may be the next step. Patient preference. Your personal preferences and desire for long-term symptom relief also play a role. Surgical and minimally invasive options for large fibroids. Even with large fibroids, there are several approaches. Myomectomy. This surgical procedure removes only the fibroids, leaving the uterus intact. This is often preferred for women who wish to preserve their fertility. Myomectomy can be performed via laparoscopy, keyhole surgery, several small incisions in the abdomen. This is often possible even for large fibroids, and some surgeons are skilled at removing very large fibroids laparoscopically. Robotic-assisted myomectomy, similar to laparoscopy but with robotic assistance for enhanced precision. Laparotomy, open surgery, a single larger incision in the abdomen. This may be necessary for very large, numerous, or complex fibroids. Hysteroscopy. If the fibroid is submucosal, grows into the uterine cavity,